683 lives lost in Italy today alone. Doctors and nurses there are on the forefront of an uphill battle, putting their lives on the line to try to save thousands of patients that come through their doors. Maggie Rulli has this report.
For the past few weeks, it seemed Italy was losing a war with the invisible enemy. But in the last 3 days, Italy's reported cases have slowed. A glimmer of hope for a situation that's ever more dire. Over 70,000 infected, more than 7,000 dead. It's taken an international effort to begin to contain Italy's cases. The Chinese brought their ventilators. The Russians deployed medics and supplies. The Americans posted on the front lines.
We just finished in the women's ward giving their morning medications. We're not able to let them go until the symptoms of the coronavirus are resolved. So they end up being here for quite some time, which can be challenging for them. Now we're gonna pop into the ICU and check on them and see how they're doing and what kind of help they need.
A constant race to keep up for those at the forefront of this battle. Every minute critical.
I would say that we are at the end of our strength. We do not have sufficient resources, and especially staff, because apart from everything else, now the staff are beginning to get sick.
And with supplies always running low, every decision counts. In this case, it means forfeiting basic needs in order to save lives.
Every hospital is lacking in these days of protections, like masks, like cover for the shoes. We cannot, for example, during our shift, go to the toilet, because this will mean to change and to change again. And this is a waste of protections.
Despite the help from others, it's still not enough. Italy turning a passenger ship into a floating hospital.
We don't have enough places for everyone.
But it's the very places that care for the sick that seem to be hotbeds for infection, taking the lives of many of the nation's caretakers. In Italy, at least 30 doctors have died since the outbreak. Officials warned it was just a matter of time before Spain saw their numbers skyrocket too. And they have, the country reporting astounding numbers despite its strict lockdown. Nearly 50,000 cases, of those, thousands of healthcare workers infected.
When I saw that within 12 hours of taking the test they were calling me, I knew that something was not right and that I was positive.
In this video circulating on social media, patients on the floor of this hospital, some heard coughing. Field hospitals that look like they belong in war zones, now a common sight there too. And around Europe, preparing for the worst to come. Italy is proof that it's imminent, that unless countries get more testing, more beds, more doctors, more supplies, they'll likely face the same fate and see the same heart-wrenching scenes of caskets silently waiting to be laid to rest.
And Maggie Rulli joins us now. Maggie, just an awful situation there, and a warning to the rest of the world for those doctors on the front lines. Now, in retrospect, do they think that they could have done anything more to prepare themselves?
Yeah, Lindsay, I spoke with some of these doctors earlier today, 2 out of a Milan hospital that's been hit so hard, and they both told me the same thing. They just wish that they had more time to prepare, to get ahead of this. They said that, they need more beds, they need more ventilators, they need more of that personal protection equipment, they need more doctors, more trained nurses, more of everything. They're just so exhausted. And what really stuck with me is they said, looking at America, looking at Europe, rest of Europe, you guys had time to prepare. You have time to get ahead of this. You should be building more hospitals right now. You should be getting more of these ICU beds. You should be getting more ventilators, training more nurses. And so they really hammered that point home, that now is the time to prepare. It is still not too late, but it's getting there. And if you don't do these things, you're going to probably end up just like Italy. Tough to hear, Lindsay.
Tough to hear, but words that we probably need to hear in order to prepare. And Maggie, switching gears just for a moment, we heard a warning today from the World Health Organization about countries potentially reopening too early.
Yeah, this was interesting, Lindsay. World Health Organization coming out, really sort of pointing the finger at countries that say they want to open up early. And they reminded these countries that this could potentially be dangerous. This could infect more people. This will not be helpful for the world if countries start to open up. And they really hammered home the point that countries need to stay closed. They need to practice social distancing, practice this self-isolation. This, according to them, is the only way we're really going to start to beat this virus. Lindsay.
All right, Maggie Rulli for us in London. Thanks, Maggie.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.